In emergency situations, every second counts. Knowing the right course of action can be the difference between a positive outcome and a disastrous one. Unfortunately, many common first aid myths persist, potentially leading to harmful actions during critical moments. This essay aims to debunk these myths and provide accurate, life-saving information to empower individuals in emergency situations. By understanding the correct first aid procedures, you can provide effective assistance to those in need and potentially save lives, including your own. Let's examine some prevalent first aid myths and misconceptions that can often lead to improper care during emergencies. It's crucial to clarify the correct procedures to ensure safety and effective treatment. One such myth involves removing foreign objects from the eye. Many believe that it's best to try and remove the object immediately. However, while it may seem intuitive to extract anything lodged in the eye, this can cause further damage, especially with sharp objects like glass or metal shards. Instead of attempting removal, it's imperative to seek immediate medical attention. Professional care can prevent complications and ensure proper treatment for minor irritants like eyelashes or small particles. Encourage blinking to produce tears, which may naturally flush out the particle. Using a clean tissue to dab at the eye can also help. Another common misconception involves treating wounds with ointments. Many people believe that applying ointment will speed up the healing process. While ointments might seem soothing and protective, they can trap moisture, creating a breeding ground for bacteria and hindering the healing process. This can lead to infections and delayed recovery. Instead, cleanse the wound thoroughly with soap and water to remove any dirt and bacteria. Then cover it with a dry bandage to promote proper air circulation and healing. This method helps to keep the wound clean and allows it to heal more efficiently. Moving on to another widely held myth, some believe that rubbing alcohol or vinegar on the skin can reduce fever. This misconception has been passed down through generations, often seen as a quick fix for high temperatures. This practice is incredibly dangerous, especially for children. Applying these substances can cause more harm than good, leading to severe health risks. Alcohol is absorbed through the skin and can lead to alcohol poisoning. The skin, being the body's largest organ, can quickly absorb these chemicals, causing toxic effects. Instead of resorting to such methods, focus on keeping the individual cool and hydrated. Simple measures like using a cooling towel or ensuring proper ventilation can be very effective. Maintain a comfortable room temperature and encourage the consumption of fluids. Hydration is key in managing fever as it helps regulate body temperature. If the fever persists or worsens, seek professional medical advice. Consulting a healthcare provider ensures that the underlying cause of the fever is properly addressed. Another crucial myth to debunk involves lifting someone who has fainted. Many people think that lifting the person will help them regain consciousness faster. While well-intentioned, this action can be detrimental. It can cause further injury or complicate the situation, especially if the person has an underlying condition. Instead, ensure the individual is lying down and loosen any tight clothing to promote blood circulation. This helps in stabilizing their condition and prevents further complications. Once they regain consciousness, allow them to sit up gradually. This prevents sudden drops in blood pressure and helps them adjust to an upright position safely. Section 4. Fever and fainting. Addressing myths about body temperature and consciousness. Fatigue is a common ailment, and many believe that coffee or energy drinks are the solutions to combat it. However, these beverages can dehydrate the body, exacerbating fatigue. The best course of action is to prioritize hydration by drinking plenty of water and allowing the body to rest. Another area rife with misconceptions is burn treatment. Some believe that applying butter or sour cream to burns can soothe the pain. However, these substances can trap heat, leading to further tissue damage and increasing the risk of infection. The appropriate response to a burn is to immediately cool the affected area under cool running water for 15 minutes. Section 5. Burns and blisters. Dispelling harmful practices. Blisters, often accompanying burns or friction injuries, are another subject of misguided first aid practices. Contrary to popular belief, popping blisters can do more harm than good. Blisters act as a natural protective barrier against infection. Interfering with this natural defense mechanism can introduce bacteria into the wound and delay healing. The best approach is to keep the blister clean and protected, allowing it to heal naturally. Section 6. Sprains and fractures. Understanding proper immobilization and treatment. Sprains and fractures, common injuries affecting bones and ligaments, are often mishandled due to prevalent myths. These injuries can occur during everyday activities, sports, or accidents, and knowing how to properly address them can make a significant difference in recovery time and overall outcome. One such myth suggests applying heat to sprains. Many people believe that heat can soothe the pain and promote healing, but this is a misconception. However, heat can exacerbate swelling and inflammation. Applying heat to a fresh injury can increase blood flow to the area, leading to more swelling and discomfort. Instead, apply a cold compress to the injured area for 20 minutes at a time, with breaks in between to reduce swelling and alleviate pain. Cold therapy helps constrict blood vessels, which can minimize swelling and provide a numbing effect to ease pain. When dealing with suspected fractures, immobilization is crucial. Keeping the injured limb still prevents further injury and reduces pain. Attempting to realign or set a broken bone is not only excruciating, but also potentially dangerous, as it can cause further damage to surrounding tissues and nerves. This is why it's essential to avoid moving the injured area unnecessarily. Instead, immobilize the injured limb using a splint or sling, and seek immediate medical attention for proper diagnosis and treatment. Professional medical intervention ensures that the injury is assessed accurately and treated appropriately, which is vital for optimal recovery. Section 7. Conclusion. Empowering yourself with accurate first aid information. In conclusion, understanding accurate first aid practices is essential for responding effectively to emergencies. By debunking prevalent myths and equipping ourselves with the correct knowledge, we can avoid exacerbating injuries and potentially save lives. Remember, acting swiftly and confidently based on accurate information is crucial in emergency situations. Share this knowledge with others and help create a safer environment by promoting awareness of correct first aid practices.